She got it
Hi.
right.
Yeah, every single time. If anyone has like a Mac, every time we go to film it, I am in charge and I press the take a picture button.
Yes.
So there's a picture of us looking really confused at what's happening. So hello, welcome back.
Hello.
It's Christabel.
Yes, and Norafiah.
And you should know who you are because the 10 people watching our videos, it's probably not even 10 full people, should by now know who we are.
Yep.
But in case you don't, I'm Christabel Samy and I own a medical practice in Rockingham in Perth, and we're really all about trying to make having babies as natural as possible and giving you guys all the information and the facts. So if you don't already subscribe to our channel, or you do and you think, oh, I might know a pregnant person or a lady that might be wanting to get pregnant, tag them in this so they can learn about us.
Yes.
And come on now, Norafiah, say who you are.
I'm Norafiah.
Come on, I did a whole
one
spiel.
of the two.
The same one.
Yeah.
Ooh.
So
She is a little bit less crazy than
a little bit less.
I will
crazy.
give her that.
A little bit. Just don't talk to my friends about me. Okay?
Everything in moderation. And Norafiah
right.
is an amazing midwife. She works with us here.
Yeah,
She's
and
okay.
I'm also in private practice, so I do provide home birth support as well.
And I wouldn't have a midwife here unless I thought they were decent. So she's obviously decent.
I'm decent. Yeah.
What a wrap up, eh?
Yeah,
and this is part 7
Part
of our 10-part video series.
It's flying by.
It is, but it's
like,
not flying by for us because we're having to do them and think of topics. So part 7 of part 10.
Yes.
And as usual, we are not trying to replace your own medical doctors and midwives and amazing teams. We're just trying to give you some information, conversation starters, so you know what questions and questions to ask.
Options. Yeah,
Options.
Sorry.
Options to
We're
ask.
big on options. That's our key word.
Yeah, options. Correct. Everything is a choice.
Yes.
Yes.
That's right.
It's not jail. You do what you want.
Yes.
Even in jail, I think you can do what you want. But anyway, I digress.
And I suppose because we support body autonomy, right?
Yes.
And people taking responsibility for like your own care and who your care providers are as well. That's important.
And I think this is probably the most important video, today's video, because that actually leads on very much from that. Because there are lots of ways you can do childbirth in terms of painkillers or not painkillers and getting examined. And I find a lot of women, especially their second child or their third child, they know much more that they can say no, or they can say, well, hang on, what are you doing? But if not, men often say to me, or support people in the room say, I don't even know what was happening with my missus. Like, people were all up in her grill, and the lady doesn't know that it's a choice, and she can say no, or she can say, hang on, what are you doing? Or I don't want this, or I want this.
That's right.
So we're going to give you the choices for the labour bit today about painkillers.
For pain.
For pain. For hospital pain killers. Because last week we talked about some things you can do in a home birth setting.
Yes.
And we talked about I can never say this stuff.
We mentioned the rebozo.
The rebozo scarf.
Well, we talked about going into labour.
Yes, and going into
just
labour.
the signs and when to go into the hospital. But yeah, that's a good point what you're saying before. Informed consent. So we might even do a little short spiel at some point, another video about informed consent. Because,
you can tell we're trying to add to our very successful series.
10 might be 11.
Well, I mean, we wouldn't want to disappoint the 10 people watching our series.
Right. Informed consent, that's a very hot topic, and which goes back to, what you were saying, things are happening to your wife, and then and even the woman herself receiving the care when you're in labour or anywhere really. Yeah. And if you're not sure, you don't know what the risks are, you don't know what's being offered, then you have to make sure that you say stop or no, and just take the time to make a decision, because it does impact on me or
do you know where I actually was really inspired by this idea? I've got a story, but shock horror, Christabel, there's a story. Oh no, not another story.
10 minutes, Christabel.
Well, no, it's okay, we just add it to the next part. So when Ibu Robin Lim came, who is amazing. She inspired me to really get on board with doing this antenatal stuff here. Yeah. She came, she's brilliant. If you don't know who she is, Google her. CNN Hero of the Year, just an amazing woman. Yeah. She does midwifery in Bali in Indonesia. Yes. But her very first slide when she came and presented here last year, she put a conventional table or hospital bed that a woman would have a baby in here. And in hospitals that tends to be, a bed, stirrups, metal, quite scary looking thing.
Yeah.
And then she put a medieval torture bed next to it.
Yeah.
And look, I'm not saying that we're torturing you in hospitals in childbirth at all, but the two had some similarities. And she was saying it in the point of, not only are you on this bed, stirrups, but everybody is coming in. Nobody introduces themselves. Yeah. Nobody is explaining what they're doing or why they're doing it. Yeah. You perhaps don't realise that you can question and say no, or just ask. You know, you might not say no, but you might just want to know what's happening, because then we're all comfortable. Yes. So that's where I was really like, oh, wow. Like, we really don't think about it.
No.
And we don't think
things so
about
routinely.
Yeah.
And it's just a course of a normal day for us, but we don't realise the impact that it has on the woman or the person receiving care.
And I mean, I haven't had children, but I will not be looking forward to everybody examining me down below and just putting fingers where they need to. And that's a weird process. That's not normal life. No. But when you're giving birth, everybody seems to want to, you know, feel how ripe that cervix is. Yes. And that's an odd concept to most normal people.
Yeah, that is.
Let's be honest. Yeah. So that's why we want to kind of prepare you for this, so that you can go, oh, that's what's happening. They're checking my cervix. Yes. They're checking the ripeness of it. Yeah. whatever it is. Okay, so painkillers.
So the stuff. Which that kind of is a good lead up into
4 minutes.
So in labour, like Mother Nature does not make any mistakes, right? So our bodies are geared to have babies, naturally, without painkillers. But you've got to have the right conditions. So I just want to show you. Oh, no, you can set it backward. But this is this is really good. Dr. Sarah J. Buckley. So this is a download from her page of ecstatic birth, and she talks about the hormones that are needed in labour. So it's not just oxytocin; it's prolactin, progesterone, your beta endorphins. So basically, you know, oxytocin increases, contractions come, and then crosses the blood-brain barrier.
Yeah.
And then your endorphins kick in,
Yes.
So then when you watch a woman labour, you'll see she kind of starts to change. So she goes from being like chatty, and then like having to focus, and then she can no longer talk, and then it almost looks like she's high or in an altered realm, And then she'll get to the point where she'll change again.
And that's all the hormones.
And then that's all the hormones. So to release all the right hormones, so what you want to do is release all the right hormones, and you don't want to release like adrenaline and cortisol, which is your fight or flight.
Yeah.
Yeah. And that's the difference between a woman labouring normally and birth going smoothly.
Yeah.
And birth happening relatively quickly for the woman.
Yeah.
As opposed to it being dragged out. Yeah. So the environment is really important, and you support people, so you want to release all those.
And we talked last week about how it's like preparing for a marathon.
Yeah.
So you've got to get your head right and calm. So
Yes.
reading things like that, is that something that people can access?
Yeah. So
Google
this
it,
is
Sarah
Google
Buckley.
it, Sarah J. Buckley, and it's free download.
And we have no affiliation to her. I've never even heard of her, so she clearly ain't paying us for any
No.
sponsored stuff.
No, but I
Sarah.
love her stuff. And if you come to see me, I can give you this to you for free. Anyway.
Shout out Norafiah!
I will use Christabel's photocopier and download this. But this is excellent because she also covers things like, like if you interrupt that cocktail of hormones or the flow of the hormones, and it can actually impact, and it is again the difference between a longer labour because it's not disturbed, or it just takes that little bit longer because you're having other interventions.
Yeah.
Okay. So this is a really good.
Yeah, just to learn and remember that, as Norafiah said, women have been having babies for centuries and continue to do so in some other underdeveloped countries without any medical intervention at all. And I'm not that's not us having a go with painkillers, because I would have lots of painkillers if I was having a baby tomorrow. Norafiah probably doesn't know this. I would be give me everything and give me 10 vials of it, right? But it's about recognizing that our bodies can get through it.
Yeah.
And it's all about going in with a positive mind and attitude and knowledge.
So positive mindset, and just preparing really, because you can, like, fear is actually good, and you need to be able to, because it kind of helps you plan. Yeah. So it's about being well informed and knowing what your support or your coping mechanisms are. So that's why some women do hypnobirthing.
Yes.
You can use so be like with the environment, making sure that the room is nice and dark.
Yeah.
Because if it's bright lights, everything's like or you feel like you're being watched. Yeah, so then you can't kind of get into the flow of the birth hormones.
Yeah.
Water, so women use the shower.
Yeah, which we touched on.
And then the pool.
And just, this is, so I said last week I would ask all those silly questions and say all those things that everyone is thinking. So biggest thing I learned from doing obstetrics and gynae, women are wondering, firstly, what happens if you take a dump during pushing? That's what people ask. All those silly questions. I know you're thinking it, people. Norafiah's looking at me like, did Christabel just say take a dump? Yes, because do you know how many women tell me what happens if I push and something comes out?
Yeah.
And the fact is, shit happens.
Shit happens.
And it happens. So you're in the whole crux of getting this baby out.
Yes.
You are probably not even going to know really that it's happened.
No.
And the midwives just swoop it all on out. Yeah. Like, ain't nobody got to worry about that. Because people do worry.
They do.
You don't, just the silly things like being groomed down there or not groomed. Yeah. Ain't nobody cares. No. Don't go put makeup on. Nobody needs any of that stuff. Right. It's true. So that's part of being calm for the impending delivery.
Exactly.
Right?
And that's why normally before women going to labour, part of it is that they have to sit on the toilet and just empty their bowels, right? So you might get a bout of diarrhea, which we talked about, I think, in video number 3 or 4 or something.
That's one of the signs.
So that's one of the signs, but it's also your body's way of clearing up, so then you don't have to worry about it.
Yeah.
And even if it happens in labour, it's inevitable anyway, because that baby's going to come past that area where it all
and when you push, like I haven't had a baby, but when you push, it's like trying
it's kind of like that.
Yeah. I don't need to say, you all know what I'm doing, what I'm talking about here. Yeah. So don't worry about that,
don't
right?
Worry about that.
Yeah. Yeah, because people. Now, let's get to my favourite bit. Let's get to the good stuff. Okay, give me those drugs and give me a lot of them. I tell you, Christabel is not going to have a baby without paying
No.
So I've got a couple of drugs that I know we use, and I just wanted to get some pros and cons from a hospital midwife point of view.
Yeah.
So, you can have things like Panadine Forte, can't you?
Yes.
Which is Panadol and codeine.
Yeah.
That works, doesn't it?
For in the early parts of labour, I mean, like it have to be woman to woman, woman by woman basis sort of thing. So in the early stages of labour, so you're labouring at home and you think, I'm going to go in, need some pain relief, and when you go in, the midwife assesses you, and if you're still what we would consider early labour, you're only like 2 or 3 centimetres or something, and but you need something, then that's one of the medications that you'd be offered, Panadine Forte, and then usually, you can go home. And what it does, I guess it just kind of dampens the pain a little bit, so then you can sleep, or just kind of help.
Because that's in the early stages where you've still got a long bit of the race to go.
Yeah.
So Panadine Forte, then you can get to the good stuff, morphine.
Morphine, so that's given as an injection, intramuscular injection. They normally give it with something that's just going to not make you throw up.
Yeah, because morphine often makes people quite sick, so we often will give you a little bit of an anti-sickness injection as well with it.
Yeah.
And again, it's an injection, but you won't really feel it because you'll be labouring, so you'll be glad for the relief. Yeah. And that doesn't really affect sort of how you feel contractions or anything like that.
No, this is really interesting because so some women, so if you've never had morphine before, you just need to be aware of some of the adverse effects. So you can make you throw up. Now with some women, they've told me that it actually does not take away the pain of the contractions.
Oh.
But it just kind of makes them appear like they're coping, but they can feel everything, but it's like they can't respond to it.
Okay.
Yeah, so that's really interesting. Yeah. But the idea of morphine, like with all pain relief, is just to kind of, dampen those contractions. Yeah. So most women are able to sleep with the morphine.
Yeah.
Yeah.
Because it will make you a little bit drowsy often, especially if you've not had it before.
Yeah.
And you're sort of morphine naive. That's the word? Naive? Like you've never had it before. I'm trying to be intelligent. I really should just stick with me.
The only thing with morphine is because like any opioid we give can cross over to the baby. Yeah. So with morphine normally we don't like to give it within 4 hours, potentially within 4 hours birth. because it does go across to the
baby.
And
the concern then, when we're that close to delivery, is because morphine can sometimes depress or dampen your drive to take breaths and have good respiration, so good breathing. Yeah. So we wouldn't want to do anything that's going to mean that it's harder for baby to take breaths. Yeah. So that's why right at the tail end, we would be encouraged not to use
morphine. And usually the babies will come out a little bit stunned and probably will need a little bit of resus because of that. But like your midwife will kind of talk you through all of that anyway. If you are insistent on having the morphine.
Yeah. And then the other thing that a lot of women talk about or think about is an epidural. Mm-hmm. So lots of pros and cons about this one.
Yeah, so now with an epidural, the beauty of an epidural is you won't feel any contractions up here. And most of the epidurals now that they administer, like you won't feel any pain, but towards the end you might just still feel pressure. Mm-hmm. So sometimes, like I've looked after women before where they get the epidural in, and because they've just progressed really quickly, that it hasn't really made any difference because they can still feel that intensity of the pressure. Yeah. It's not a pain as such, it's more like an intensity.
Yeah. It's a bit like if anyone's ever had local anaesthetic, so if you've ever had an implanon put in, so that's the little device for contraception, or if you've ever had a finger numbed so people could look at it when you've injured it, the local anaesthetic doesn't make you not feel anything. Yeah. You just feel a bit of tugging and pressure. Yeah. And you will still feel that. It's just not pain. Yeah. But, like, you can still feel things because if not, you'd be dead.
Yeah. Yeah. But, it's more that pressure of pushing, unless you've got, like, quite a high block, and that's probably if you got the epidural a lot earlier on in labour. Yeah. So then
and some women do. Some women say going in that they want the epidural and it's done earlier. Yeah. Others might not pick it until later
Yeah. And usually discuss with your midwife when would be the optimum time to get it, because ideally if you can avoid it altogether and employ other things like like nitrous, use the water and all that sort of stuff, or even most women will find that they'll have morphine in the early stages. That's enough to give them a bit of a rest. They can kind of relax a bit and then get them going for the next, that they're able to cope when they get to the last stages. Advantage of the epidural, you don't feel any pain, but the disadvantages would be you have to be constantly monitored because it's going to go across to the baby. I've got to check your blood pressure, all that sort of stuff. So you're going to be attached to a machine. If you don't feel that urge to push, then you'll probably have to be coached, which is quite risky in terms of like a prolonged second stage, increase incidences of like getting a tear.
Yeah, and that's just because you don't often feel the urge to push because you don't have as much feeling.
That's right.
So it can sometimes mean that it's a slightly longer labour.
And then again, if you end up having it like too early, it has the effect of like what we call it, like knocking off your contractions. So your contractions get really spaced out, which then means you might need to be augmented, which means they may have to give you the synthetic hormone to get your contractions going again. Yeah, so potentially it can actually lengthen your labour. Yeah. So you think like, okay, it's the trade-off between like no pain or longer labour, and then with all those additional stuff. Yeah.
So there's lots to think about, but this is all stuff that we kind of want you to have a think about before, because if you're leaning towards I really 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 want an epidural, then we just need to know about it and plan for it and go through all the pros and cons. And also, if you're really thinking I don't want an epidural, that's fine. We just need to know about that so we can prepare what sort of pain things we're going to do.
Yeah, the main thing is like you're well prepared beforehand, so you need to know what your coping mechanisms are. Like how well are you with pain? So, and remember, like with labour, when it starts, it just kind of keeps going. So you have to employ all those, the techniques. Yeah. So whether like mentally, physically, your environment, all that sort of stuff. Yeah. And at the end of the day, too, if you change your mind, so even if you go and say, I don't want an epidural, that's actually okay to change your mind. And if you need it, you need it.
Yeah.
So.
And often, actually, when you say you need it, it's so late on in the game that we probably might not get it in time, actually.
When is it too late? When there's a baby.
Yeah, when the baby's head is half out. Like, this show is going.
Yeah. And the other thing, too, don't discount, like, our own bodies, one coping mechanisms, but, like, the strength that women have.
Yeah.
Like, just don't kind of, what am I trying to say here? don't give up on yourself before you even start or before you even know how you're going to be with the pain of labour. And the pain of labour is actually good pain.
Yes. Yeah? And you get a baby out of it.
Yeah. It's supposed to be pain, but it kind of teaches you what you need to do. And
what Norafiah is basically, she's basically looking at me saying, Christabel, I don't want you all doped up. You're going to have a home birth with nothing but that scarf, all right? That's right. You've got a few years yet for that, so don't worry about that. So yes, you can do it, so think positive.
Yes.
So hopefully we've given you a couple of ideas about pain relief. So natural, which is to shout out to this amazing resource.
Yeah.
And then a couple of things to think about. And then next week, we will be talking about immediately post-labour.
Oh, yeah.
What happens.
Okay.
Yeah, just a little bit about placentas and all the rest
birth
of it.
Of the baby.
Birth
of the baby.
Yeah, a little bit.
Placenta, a little bit.
I've skipped ahead. It's too traumatic. So hopefully you find our videos helpful. If you'd like us to cover anything else, make sure you write to us and let us know. Nobody's been doing that, so I reckon we'll answer your questions. And yeah, hopefully that's been useful. Have a lovely day.
See you guys.
Good night. Bye-bye.